Anyway, she mentions hydroxychloroquine and ivermectin. Now, I know the answer to this question, but let me ask you anyway. Have you got any experience as a doctor prescribing hydroxychloroquine?
Well, John, you don't know it, but I'm a clinical immunologist. And clinical immunologists, well, we have a few more tools now because we've got monoclonal antibodies, but for the bulk of my practice, we had steroids, we had hydroxychloroquine, and anti-inflammatory. We had a few things, and intravenous gamma globin. We did have a few things, but hydroxychloroquine is an amazing drug. And what a lot of people don't realise is that, well, first of all, hydroxychloroquine is a derivative of quinine, which comes from fever bark, back in Peru, when the Spaniards were, and the Spanish missionaries found that every time an Indian in Peru got fever, they'd take, which was malaria, they'd take quinine. And that's how the story developed. And so it went from quinine to the first chemical that was made that was a little safer than quinine, which was chloroquine. And then because chloroquine has some problems, we got hydroxychloroquine. And so we had this transition. And so young doctors like me could use hydroxychloroquine.
So the hydroxychloroquine is safer than the chloroquine?
Yes, you get less complications, less eye complications.
Yeah.
So the interesting thing was that because it was a fever drug, in the 1918-19 flu pandemic, the Spanish flu, so-called, a number of doctors, including Burroughs of Burroughs Wellcome, were using were using
hydroxychloroquine. Quinine,
quinine.
Sorry, it wasn't invented then. That's right, quinine, yes.
They had quinine and claimed significant benefit. Now, the data seems to have been lost in the Burroughs Wellcome Foundation somewhere, but he published this that he noticed a benefit, and so it wasn't surprising that when the Chinese started screening drugs, as soon as they found the pandemic began in Wuhan, they screened. They did a great job, and the drug that stood out in the test tube was chloroquine, hydroxychloroquine. And so it wasn't surprising that a lot of people started using this. And of course, the story is it's an incredibly effective drug. A magnificent study has come out just since after the book was published, showing a randomized controlled trial, everything that people have been screaming for. But the publication of that study was held up for 3 years. No one would publish it for 3 years until the pandemic was over and they thought no one would really notice it. I mean, I tell you, can you believe that?
Sadly, yes, I can. The sheer cynicism is distressing. And there's plausible mechanisms of action for hydroxychloroquine, is there?
Well, yes. Traditionally, it's been shown to change the acidity of vacuoles within the cell that are critical for viral reproduction and for various other things. Again, as a result of COVID, smart chemists started looking, and one of the arguments that were used against the hydroxychloroquine as an effective drug was, it only works, well inside the cell. These clever people found that hydroxychloroquine bound to a protein. Imagine, here's the cell and the virus is binding, and it's got to get inside the cell to use it as a factory to make lots more virus. It needs a transporting protein, and the hydroxychloroquine binds to this protein and stops it putting the virus inside the cell.
So it's a competitive inhibition, essentially.
Yeah, inhibiting the reproduction of the virus before it could get into the machinery of the cell to take it over, like parasitically take over the function of the cell.
And this is known biochemistry. This is not speculation.
I know. This is published in a recognised,
it's recognised science.
Yeah.
Then of course we've got the zinc ionophore effect as well, haven't we? Channeling zinc into the cell.
I think that's the interesting thing about it. Very interesting thing, and I think, if you like, a metaphor for the whole of the COVID experience, which I hope comes out in our book, is that you've got a number of drugs that are repurposed, that have been around, basically of biological origin. They come from ground up bugs or ground up trees or bark or whatever. And these are defensins. These are molecules that actually are there to protect against systems that can't have the luxury of developing antibodies. They've got more primitive systems.
Trees and bacteria, for example.
Trees and bacteria. And so they have to produce chemicals like quinine and like ivermectin. Both of them come from those sources that have multiple sites within the cell. And so what they're doing, even though we now know that hydroxychloroquine and ivermectin both have a function at the surface of the cell, they've got multiple spots within the cell, so they make the cell less capable of acting as a factory for the virus. Whereas the antivirals, of which there are two main ones that most people have seen and heard of, molnupiravir and got a mental block. I'll think of it.
So have I. Yeah.
Anyway, the two.
Remdesivir.
Yeah, that's right. No, not remdesivir. That's hopeless. No, this is the ones that you could actually take by mouth.
Oh, right. Okay. Right.
Yeah, and they only affect the viral actually coming and attaching to the cell. Both those drugs have now been shown not to be effective in large studies. One done with 20,000 people for molnupiravir in England. I don't even think they use molnupiravir in England. If they do, they shouldn't. And Paxlovid, I'm sorry, is the other one we're talking about.
Yeah.
And Paxlovid has just been shown beautifully by the original people who did the study purporting to say that Paxlovid worked, doing it paid for, sponsored by Pfizer, and it had zero impact. And of course they had to publish it in very small print in an obscure journal. And yet people are still paying in this country $1,000 for each pop when it's doing nothing to have a significant benefit on their outcome.
Well, if industry data shows it has zero effect, it might be even worse than that. Who knows?
Well, who knows? Well, of course, they do have side effects. So they're not nearly as good. These drugs that you're getting prescribed at the moment, pushed by the pharma companies, are not anywhere near as good as the cheapy drugs costing $1 a pop. Ivermectin and hydroxychloroquine. I'm prepared to argue with anyone about that, but no one's accepted the challenge.
There's no question hydroxychloroquine and ivermectin are both effective in COVID and probably multiple other conditions.
Absolutely.
If they're given at the right early stage.
Well, I'm using it very effectively in patients with post-vaccine damage. In fact, there's a chapter in the book where I talk about the whole business of post-vaccine damage and why it comes about and how it fits with the genetics. And I've even got a picture of the very first patient that I treated on the graph showing a resolution of symptoms.
And dramatic resolution of symptoms in a large proportion of cases. And I've had the privilege of meeting some of your patients who
that's right, you have. Yes.
Concur completely with what we've just said.